Ji, I'm Professor Dr. Rafiq Khanani, President of Infection Control Society of Pakistan, and I have been looking at the public health issues since almost more than 3 decades, and we have seen various epidemics coming to Pakistan as well as globally, and how to deal with it. So that's an area of my interest.
Sir, thank you very much. Sir, because of your background and because of the relevance of your knowledge, the first question which we would like to ask is, what do you think, what is the challenge to our frontline workers and how can we make them safe?
The real challenge for the healthcare workers, the frontline workers, of course, majority of them are healthcare workers, and some of them are, of course, ancillary staff providing the support, and even in the non-clinical areas. So healthcare workers' safety is of the foremost importance, but unfortunately, even in the best parts of the world, best countries of the world, richest and the countries which have got all the resources, they were also ill prepared to face the challenges which this COVID epidemic has brought. The healthcare workers' safety was really compromised at almost every place and every location. So the China started it, even China also started a little bit later, but all the other countries had time, to prepare themselves. But unfortunately, it was not done. And that's why the damages caused to the lives of healthcare workers has been phenomenal. Colossal losses has occurred. Now, coming to what can be done and what should be done. The real importance is the environment that we provide to the healthcare workers while they are working and dealing with the patients, either who are suspected of COVID or who are suffering from COVID, or even they are coming for any other ailment and they might have a condition in which they might be harboring the COVID virus, SARS-CoV-2. So we have to think and suspect that everybody is affected by this virus. So the healthcare workers and the environment which is being provided to them should take care of all those things. Now coming to the part of the hospital or healthcare facility. The healthcare facility should have all the kind of arrangements so that there should not be any crowding or overcrowding. It means that the facility entrance should be regulated and only the people who have their appointment or their turn, they should be able to, and they should be allowed to enter the facility. Now, when they come in contact with any of the workers, the frontline healthcare workers, that may be a receptionist at the hospital or the front desk worker who is registering the patients. So those people should also be protected by a barrier arrangement, not necessarily biosafety level 2 or 3 type of arrangement, but there should be sufficient distance between the patients and the healthcare worker or even the reception staff who is working in the non-clinical areas. So that reasonable distance should be maintained, number one. Number two, the person who is there at the front desk, he should or she should also have all the kind of PPPs, and they should be trained on how to apply the PPEs, donning and doffing. That should be properly trained on donning and doffing. The most important thing, there are two most important things. One is the face mask and another is the hand hygiene. Of course, the hygiene and the protection of eyes are also important, and the face mask is also important.
Okay.
But unfortunately, most of these supplies that are available in the market and that are being provided to the healthcare workers, they are not up to standards. The surgical masks are not properly surgical masks. The face shields are also not proper. The goggles are also not appropriate. And that's this kind of dresses that conveys sometimes false impression. Similarly, now since we have known that the COVID is much more aggressive than all the other viruses,
Right.
so an additional layer of protection by coverall is also important. So that if there is one barrier which is breached, then the second barrier is also there. So I think that all the people who are working in the healthcare facility, that may be the receptionists, that may be the frontline workers, that may be the physicians, that may be the nursing staff, they should all have complete PPE made up by the standard companies meeting all the required and desired standards.
Thank you very much, Dr. Saab. What do you think? What is the reason that COVID is late in Pakistan and in Africa and in India? Why? What do you think? What is the reason?
This delay is that COVID was detected in Pakistan, India, or even African countries. There can be several reasons. But I think that the most important reason is that the virus has started appearing in our parts of the world, but we were unable to detect it. Even in China, the virus probably has started somewhere between September and October 2019. And they started looking at the cases and getting cases and suspecting something different was from the 1st of December. And they were able to label it at the end of December. So generally, there is a lag period of 2 months when people started getting the disease and the doctors or the physicians started suspecting it. And I think this is the same way it has happened to Pakistan or other countries. The reason behind, even in Iran, it was a little bit late compared to China. So I don't think that there is any specific reason for this delay. We were not able to do the tests and we were unable to identify the cases, and that's why we thought that it has appeared in our part of the world 2 months later than the other parts of the world.
Okay. Doctor, do you think should we lift the lockdown, or what do you think about the smart lockdown? What do you think? Or should we allow the people, as Swedish are doing?
Now, the real problem of this virus is its high RO value, that its transmissibility is very high.
R value is high.
And perhaps one of the reasons is the low doses that is required for the infection to be effective. Now, coming to the lockdown. Lockdown is not the solution of the problem. It is just delaying the high impact of the disease, and it will give us more time to be prepared to face the challenge. And this gain of time may provide us with a better treatment approach. Maybe we will be able to get some vaccine. Maybe our physicians are more trained. Maybe we have got more PPEs available of better quality and proper quality. Now, coming to the lockdown. Lockdown is not a solution. Now, the smart lockdown, very few people can understand what do we mean by standard, what we mean by smart lockdown. Smart lockdown is opening up of the facilities which are of essential nature, but taking all the precautions. And South Korea is a good example of smart unlocking of the lockdown. They have tested everybody. So there is a simple principle that test, track, and quarantine. Test, track, and isolate. Test, track, and treat. So these are the slogans that work very well. Now, people are thinking that testing capacity is limited. I don't think that testing capacity is limited. If we do we have the targeted or smart approach. And the smart approach is that we should examine and take a detailed history of every person in any particular environment. I called it, we should have the COVID-free campuses available, and to make an area COVID-free, what we need to do is to go through each and individual person who is there in that facility. That should be clinically assessed. If required, they should be tested for coronavirus. And if the coronavirus is negative, that person should be in a facility from where that person should not be able to be connected to the outer side of the facility for a definite period of time, that may be a few days, that may be a few weeks, so that that quarantine facility will become a production facility for industries and for various kind of works. Similarly, smart facilities should be done at the hospitals and healthcare facilities. That smart unlockdown, it's not the smart lockdown, it's the smart unlocking of the facilities, where all these kind of preparations are required. And testing is the mainstay of keeping an environment at least free or partially free from the COVID infections.
Okay.
Society of Pakistan is preparing the guidelines for smart unlocking of the facilities, but it should be it should be very gradual, and it should be totally monitored.
Okay. Achha, Dr. Still the tsunami is a few weeks away. Still it will take maybe 3-4 months for the significant numbers to come forward. Don't you think we have 3 to 4 weeks? Still we have 3 to 4 weeks in hand, although we are late, but still we have 3 to 4 weeks in hand. What should Pakistan do in these 3 to 4 weeks?
I think
these are golden weeks.
But I think that the coming 3 to 4 weeks, you are very right, are very, very crucial for Pakistan, that how we behave during these 3 to 4 weeks. During this 3 to 4 weeks, we must continue and even become more vigilant and stringent in our lockdown. But at the same time, we can also start planning unlocking of certain areas or industries or facilities which are of utmost importance. And not only do the unlocking, but also monitor and see the results of that selective unlocking. And this selective unlocking can be done at various facilities. And I think that we have got all the kind of resources that are required. And in future, I always say that every facility and every industry should have a kind of infection control team and committees working. And this is not only one epidemic or pandemic that we are facing. We must be prepared to face similar epidemics much more frequently.
Okay, Doctor, what do you think? What is the role of telemedicine? What is the role of telemedicine in these anti-COVID drives?
That's very, very important question. And I think that we have been using all the kind of internet-based equipments and facilities all the time, except in the healthcare. Yeah. Now, I think that we will have to change our behavior, and we cannot afford the crowding of healthcare facilities anytime, throughout the year. And to achieve that goal, the telemedicine is a great solution. Even today, people think that telemedicine is video conferencing, but telemedicine is much beyond it. That it has got the facilities for having the patient's own records, electronic medical records are available at the same time, and the physician and the patient can come and have face-to-face with each other, along with all the data that are required, all the diagnostic tests, results, all those things are there. So if telemedicine can cut down the personal visit to the medical office by about 70 to 80%. And at the same time, it also cut down the cost of each visit and each facility. It also helps doctor doing better work in lesser time and maintain the patient's files and records. So I think that's the way forward, and we must change our behavior. And the medical visits or visit to the office of the doctor should be limited to the procedures which cannot be done on the telemedicine.
Thank you very much, Doctor. Thank you very much for sparing time and enlightening us.